Dr. Armin Schwarzbach. Welcome to Greece. What symptoms can occur in chronic Lyme disease?
Chronic Lyme can do a lot of symptoms. Most common is chronic fatigue syndrome, but we also find multiple sclerosis symptoms, we find Parkinson's symptoms, fibromyalgia, we find rheumatoid arthritis symptoms, we find symptoms of Parkinson, we find symptoms of Alzheimer's disease.
Why is chronic Lyme disease often misdiagnosed?
Chronic Lyme disease is misdiagnosed because doctors don't ask the question for it and they don't know which symptoms can be by a tick bite. And 50% don't have the beginning symptoms, they don't remember a tick bite.
Why is chronic Lyme difficult to treat?
Chronic Lyme is difficult to treat because it's chameleon, and Borrelia is a spirochete. It can move everywhere in the body and it can hide and protect. It can do round body forms, cystic forms, its name, it can do biofilms. So it has escape mechanism. It escapes the immune system, so it's really difficult to destroy or kill by antibiotics.
How can we improve diagnosis and therapies?
We can improve if we accept the diagnosis of chronic Lyme disease. Nowadays it's not accepted. The majority of doctors, they don't believe what the patients are telling them. They say it's a post-treatment Lyme disease syndrome, but this is no diagnosis for me. This is a description of the symptoms, and then the patients, they were sent off to psychiatric hospitals.
Thank you very much.
Thank you so much.
Pol De Saedeleer, welcome to Greece.
It's my pleasure. Thank you.
What is Lyme?
What is Lyme? Well, I will try to keep it very simple in my answer, but basically it's a very complicated disease affecting different systems. It's what we call a multi-systemic and multi-symptomatic disease. So a global approach means that we need to work on the immune system, on the gut, on detox, on inflammation, on all systems. So I would conclude by telling Lyme is a multi-infectious disease and we need a functional approach if you want to cure the patients.
How Lyme does affect the health?
Well, basically, if we see the symptoms in Lyme patients, most common symptoms are extreme fatigue, poor cognition, and a lot of joint muscle aches. And you can imagine, only by naming these three most common symptoms, the quality of life is automatically affected in many Lyme patients.
Which are the first symptoms?
Well, the first symptoms, depending on the kind of infection, because Lyme is not always the same infection. Usually the first symptoms are fatigue, might be local irritation, what we call erythema migrans, headache. These are usually the first symptoms. If more complicated symptoms show up, like neurologic, neuropsychiatric symptoms, this is usually only in the second stage of illness.
Is it difficult to treat?
Well, it's sometimes it's very hard to treat, yeah. But every patient is different, and that's why doctors need a good education. They need a lot of knowledge, and so we are, let's say, investigators, medical inspectors in every in every individual case. Yes, it's difficult, but if we consider a good approach, functional approach, we see very good results.
Are there treatment options?
Are there treatment options? Well, we have multiple treatment options, but basically it's not only elimination of the pathogen, it's also repairing the system. Mainly repairing the immune system is a very important part of our treatment. If patients develop chronic Lyme, it's basically because their immune system was not able to eliminate the pathogen. So next to the anti-infectious treatments, we need repairing, restoring additional treatments.
How functional medicine can help or treat?
I think that functional medicine or a functional approach is the only successful approach. If we only look at the infection and if we only consider antibiotics in our treatment, we will have a lot of failures in our treatments. So, as an answer to your question, I think that functional approach, functional medicine, is the only solution.
What is your exact professional situation?
My exact professional situation, well, I'm a medical director of a compounding pharmacy and of a nutritional lab. And next to these daily activities, I'm also a very regular speaker on conferences. And I think a very big part of my activities is education, giving support and giving advice to medical doctors.
What evolution do you see in medical treatment?
Well, I think when we compare with our medicine was, for example, only 20 years ago, medicine was very symptomatic. So let's just, what are the symptoms? Let's make sure that we can suppress the symptoms. And now we see a very interesting evolution to a complete restorative therapies where we really focus on all systems. So I think the final goal of the treatment should be not only to treat the illness, but also to make sure that we can improve life quality.
What are the further plans in Greece?
The further plans in Greece, well, I think I'm very happy with the results of this first kickoff, and I think that Christos did a fantastic job by organizing this, and I see many doctors, even though they have a lot of experience, who are very interested in this new approach, new knowledge. So I think we should see this as a start of a new story with, in my eyes, regular meetings like this, where education and knowledge is shared, and the only final goal is to make sure that we have better treatments for our patients.
Thank you very much.